Hi everyone, my name is Melanie Grant, and this is a Coding with Miss Melanie discussion for a look at our case study 8A, where we look at breast mastectomies and coding for CPT coding. Let's get started. So we're going to take a look, and I'll share my screen here, at our case study for our discussion this week, where we're talking about a right modified radical mastectomy and a left prophylactic mastectomy done on a patient in a surgical procedure for integumentary system. You'll notice here that I've already highlighted a lot of the information that I would be pulling up as a coder that might be relevant when I'm looking for the actual code. This is based off of information like location, incision details, and various information that might indicate an additional code as I'm going through this note. Now, this may seem like a lot, especially to new coders. So what I always recommend is to start off small. And what I mean by that is in your note, which I just zoomed in really big there, you have at the very top the detail for every Upnote that's going to tell you what procedure is performed based off of how the provider orders the procedure in the electronic health record, how they list it in their note, or what they're expecting to perform. Most of the time, this is an accurate description of the procedure itself. But do not code strictly from this, because this particular statement is not going to give you everything you need for the code. Oftentimes there's more information in the note, and sometimes, in fact, more often than you would think, there may be changes in the note from the actual procedure performed detail. When that happens, it's important to look for what is supported and at times query your provider. So let's look at this here. If we start off by going backwards, what I always recommend to new coders, until you're familiar with all the details in an actual Upnote, is start by looking at the procedure itself. We have highlighted the right modified radical mastectomy here and a left prophylactic mastectomy. If you're unfamiliar with these terms, please take a look at them. The definitions for a radical mastectomy, for example, are going to give you information that's very important in CPT coding when looking at the additional coding of tissue that's surrounding the actual breast. The terminology for prophylactic may throw you off if you don't recall that this term simply means that it is a preventative measure. And so sometimes there will be information that you need, and other times you may not use it in your actual coding. The first thing you should do, though, is determine where to find these codes. What is the main term or the actual surgery itself? It's not the location, it's not the descriptions, but rather the procedure itself, which is the mastectomy or removal of the breast and breast tissues. And we have two of those here. Then we look at descriptive terms that tell us about the type of mastectomy and details that tell us about the location. So when I start looking for this, I'm going to start with the term mastectomy, and then I'm going to look for things like possibly prophylactic, which describes the type of mastectomy, possibly radical or modified, which also describes the type of mastectomy. And you'll find this information when you're looking in your CPT manual. For us, I've already mapped it out to 3M, but I want to show you what this looks like in the CPT. So I'm going to skip this process, and I'm going to look directly in our CPT manual online at our mastectomy procedures. I can click here. So how would I get to this if I didn't know the code? I guess that would be the most important thing to start with. If you don't know where to start, you can go under surgery, integumentary system, breast, and then look at the subcategory for mastectomy procedures. This is organized the exact same way in your CPT codebook. So I'm going to go and look at my CPT codebook now on the back end outside of the video. And if you're following along, which I hope you're doing with your CPT codebook, I'll give you the page numbers that I find this information on. So to get started, we start first at the surgical section of our CPT codebook, which is starting on page 83. Now, these are all of your surgical guidelines, and you should be fairly familiar with this from our previous lectures. So I'm going to go directly into integumentary for my first surgical guidelines, which is the first section in my surgical chapter. Under the integumentary, which has a table starting on 87 and continuing to 88, I'll find the next subcategory, which is breast, on the bottom of or middle of 88, which indicates codes 19000 through 19499. Now I could go to that section directly, or I can continue reading to see what kind of subcategories are found under breast. And mastectomy procedures do have their own category, just as indicated here, from codes 19300, as you see here on the screen, through 19307, also shown on the screen and found on page 122 in our CPT codebook for the 2021 edition. If you're in a different edition of the CPT codebook, that's absolutely fine. But if you're watching this video at a later time, make sure to compare differences between codebooks in new codes, deleted codes, and any revised codes. So I'm going to flip to 122 in my CPT codebook, and I want to look at any kind of guidelines that might be available for this code section. I can also click here in 3M if I want to look at it in 3M directly. And if I prefer to just use 3M to get to this point, at any place within your 3M login, you can click on references, go to CPT or current procedural terminology, which takes you to the online version of your CPT codebook. I can go directly into surgery here, integumentary system, and then sadly, I have to skip until I get to the breast section, which means I'm going through the entire section of the surgical integumentary section. I should also be able to come in here under surgery. I can see a legend, so it's not going to let me skip ahead. So I would actually have to find it. However, I can search for certain phrases such as mastectomies. Which will give me a list of all the mastectomy terms, and I can see mastectomy procedures here. So that might be one way that I can go a little faster. This actually took me to the guidelines. So this may not be the fastest way to go if you're using 3M, but there are ways to do it. And my recommendation is to take your time and explore it, because you never know what you're going to find. Now, once you do get to the surgery integumentary system for the breast under mastectomy procedures, both in your CPT codebook and in 3M, you can look at the surgical guidelines that are in section for mastectomies. And because it is an in-section guideline for mastectomies, it's important to take a look at this and see what it's talking about. There's a couple of different details. And so what I like to do is I always like to just glance through each paragraph and say, does this pertain to my patient? In order for me to know that, I have to look at a little bit more detail than what I did initially. So I'm going to step out here a little bit. And what I want to look at is, what is the purpose of the procedure? What's the history? And so we see she has cancer of the right breast, status post neoadjuvant chemotherapy. So she's already done her chemo. She's an unfortunate 37-year-old woman who has had a pregnancy-associated breast cancer, extensive involvement of the breast, clinically stage 3, underwent chemo, complete clinical response to therapy, no residual palpable tumor, no palpable adenopathy, and has elected a bilateral mastectomy, which she will then have reconstructive surgery at a later time. So that tells me a little bit of information before I get started. So mastectomy procedures, with the exception of gynecomastia, are performed for either treatment or prevention of breast cancer. And yes, that would apply to our patient. Good. If not, if I was looking at gynecomastia, I would look at 19300. If I was not sure what that term means, I can Google it, and I should Google it to make sure that it's not pertaining to patients who had breast cancer while pregnant. In this case, I would find the medical term right away, which is talking about swelling of breast tissue in males. And so that would help me to identify that this does not apply to my patient. Continuing on, your next paragraph is talking about partial mastectomies. Portion of the ipsilateral procedure, breast tissue is removed. Complete options for complete axillary lymphadenectomies, and in addition to partial mastectomies. And then it goes on to say when the breast size reduction is not for treatment or prevention of breast cancer, so if they're just having an augmentation, they give you different codes. The next one talks about total removal of ipsilateral breast tissue with or without removal of skin and nipples. Does not include excision of pectoral muscle or axillary. So this is giving me definitions and descriptions of these two codes in order for me to determine what the difference is between them. And so at this point, I can just kind of glance through that. I can see information about lymph nodes, and again, for male breast removal. Radical procedures is also mentioned here with the codes that apply for radical breast procedures. And you may remember that the term radical is one of the terms we have. It gives me a definition of what this includes. And then for bilateral procedures, they also give me specific codes and instruction on what modifier to use. So this is all very important information when I'm reading through my in-section guidelines, and it's most likely what's going to help me when I'm trying to determine between those complicated codes. We'll probably come back to those. For now, I just want to look at what does the code entail according to the description and according to the guidelines for, we'll start with the first one here, a modified radical mastectomy for my right breast. So I can look through here and I can see that there's mastectomies for partial, mastectomy simple or complete, which again, if I'm confused about when do I use this code, I can go back to that guideline and say, what is 19303? What does simple or complete entail? And it's going to tell me exactly what this entails. I have 19305, which is radical, including pectoral muscles and the axillary lymph nodes. I also have mastectomy radical, including pectoral muscles and auxiliary and internal mammary lymph nodes. And then I have mastectomy modified radical, including the lymph nodes with or without pectoral minor muscles, but excluding the pectoralis major muscles. So off the bat, I see a few terms that I'm looking for. I see the term mastectomy at 19307. I see the term modified radical. And then I see additional terms that I know I need to look for in my note. So at this point, I want to confirm, did they meet the definition for mastectomy? Did they meet the definition for modified radical? And did they include the auxiliary lymph nodes? And while it's not important if they include the minor muscle, the pectoralis major muscle cannot be included. So I want to read through the note to verify these things before I select 19307 as my code. But most likely from reading up and down on all of the codes that I had for mastectomies, this is the code that I'm going to use. Now, here's another thing I love about 3M. You also have a CPT Assistant, which can give you clarification on some of the coding procedures and details by coders that commonly have questions in these areas. The CPT Assistant will list all of the current applicable references. So even though this says CPT 2007, this may still apply. Some of the clarification may still apply from 15 or from 2020. Now keep in mind with the updates and the changes, this may just be something that's talking about code changes or deletions, not necessarily current codes. But this breast surgery coding clarification, that's actually going to be very relevant to my current procedures. And I might want to look through this if I'm having trouble to see if it can help me with one of the questions they have. Now, once I've determined all of that information and I've read through everything that I need to get started, I can start abstracting in the note. Again, I want to keep in mind, I'm just looking at the right procedure, and I'm going to do a different highlight so we can kind of capture this. I have the right radical mastectomy. I want to verify that it's modified and that it's radical based off of the description in the code. And I want to make sure we actually did do a right mastectomy, because even though they listed it, it's still important. So I can come into the Upnote and I'm going to read through this. Now this is the part where it's going to sound like we don't really care about a lot, but we really do. There's a lot of documentation that's listed for clinical purposes that's not necessarily as important to us in coding. So when I say I don't care, I never mean that I don't care about the patient, what they went under, or the information that's in the note. I simply don't care for coding purposes, and it's kind of fun to say it that way. So I'll start by reading the Upnote, which is where the actual detail of the procedure is found. The patient was taken into the operating room. Well, gee, I hope so. General anesthesia was induced. Don't care. A Foley catheter was inserted. That's included in any procedure when they're in the operating room, so don't care. Her arms were placed on pads. Her legs were placed on pads. A bear hugger was applied to her entire upper torso and was sterilely prepped and draped in the usual fashion. Typically, anything up to the usual fashion is just telling us the position the patient was in, and it's not necessary for coding. So unless I'm coding something where the direction of the approach matters, like spine surgery, I don't care. Symmetric skin-sparing mastectomies. Now that I do care about. Were planned. That means it hasn't happened yet. Incorporating the nipple areolar complex on both sides. So that's what they came in for. They began on the left side. Okay, I'm going to pause there and I'm going to say I want to start with the right side because that's the code I've prepared myself for. So I'm going to read through all of this, just kind of glancing because I'm looking for them to move to the right side. Now, there's certain things, and of course I've already highlighted, that I can maybe highlight along the way that seems important. But if I'm not as familiar with this note, I don't want to get stuck in the weeds. So I'm looking just for the right breast, which I'll find here. So we moved to the right breast. Okay, so that's where the right breast procedure started, is at this point. We'll come back up here for the left in a minute. An elliptical incision was created. I might ask myself, what is an elliptical incision? This is talking about the actual type of cut that they made, and it's not necessary for most procedures for us to know the type of incision. However, if you're uncertain, take a look and see what it says in your medical dictionary or on Google. And remember, Google is your friend, but never marry her. Now, this was incorporating a nipple areolar complex. Again, something you might want to look up if you're not familiar. And a little more skin laterally in that breast because it was larger. Okay, so you may have to read through the previous note to see what do they mean more skin, because when they're talking about this, they're talking about how much skin is taken or incorporated for this particular procedure. Flaps were raised from the superior infraclavicular and a portion of the breast circumficially into the midline and subsequently into the inframemory fold and subsequently out to the latissimus dorsi muscle. So this is all telling us, and again, if you are having trouble with any of the medical terminology, look it up. This is all telling us about the types of incisions, how far they went, and where it was made to. So you have in general your breast tissue, and they're saying, okay, we went this way, we went down in, we moved over, and this is where we ended up. This is all about the cut to remove the breast. And so this is not necessary for us at this point to code. Now, if the procedure, if any of these terms include something like, remember, we are looking for the pectoralis major muscle because it cannot be included in code 19, what did we have? Now I have to go backwards and see what we were looking at. (19307) can include the pectoralis muscle, but it excludes the pectoralis major muscle. Okay, so it's important to keep that in mind as we're looking through here. The dorsi muscle is just talking about where they cut up to. If we were doing certain procedures that required intensive details to say what layer of the skin, such as the fascia or the muscular or the subcutaneous, this might be important in identifying our layer of skin. But for this procedure, it's not something that's classified under this section of coding. So I can continue reading forward. The breast was removed. Perfect. I have already confirmed the first piece of information I need, which tells me that in fact, a mastectomy was performed. And it was removed from the pectoralis major muscle, incorporating the fascia reflected laterally. Now take a moment to dissect that statement. If it's removed from the muscle, does that include the muscle? No. It means that they've separated the breast tissue and left the pectoralis major muscle behind. Incorporating the fascia is talking about what layer they did take. So they did take the fascia and they reflected laterally. So they're talking about how they went along the side of the breast in order to follow through that procedure. Okay, so everything at this point, a mastectomy, modified radical, which again, if we're not familiar with what that entails, we can look at this description and see that it includes the removal of the ipsilateral breast tissue, including nipple for treatment of breast cancer and excision of the pectoral muscle and or lymph nodes. Now, because this is modified, you'll remember that it did not include the nipple, and it specified that it did not include the major muscle. And so this is just a brief description of all of these and what might be entailed in radical procedures. Basically, you want to understand what is a radical mastectomy to understand that it includes the surrounding tissue. Okay? And again, you can take this as slow as you need to. So at this point, I have confirmed, and sometimes I might feel comfortable to say, hey, this has, from all of the coding options, I don't necessarily need to read much further except to find out, was this including the auxiliary lymph nodes? That's really the only thing that's left for this code to confirm, but I still prefer to read through the whole procedure in case there's something that we might have missed. We don't want to stop just here. So the clavipectoral fascia was opened and sampling of level 1 and level 2 axillary lymph nodes were dissected. So the sampling of the level 1 and level 2 axillary lymph nodes being dissected is saying that it is including the auxiliary lymph nodes. Everything else before that is just talking about the location. It was done on both sides. That's important to know. Sparing the long thoracic and thoradorsal neurovascular bundle, as well as at least one intercostal brachial cutaneous nerves. So what they're saying, if you've ever looked at any of your breast diagrams before, maybe for radical mastectomy, might help if I spelled that right. I can look at this up under my images for Google. And if I really want to see what this looks like, I can actually look at some of the pictures and see exactly what is it that I'm looking at when they're talking about all of this detail for this procedure. A left modified radical mastectomy, this is actually showing me exactly what the procedure is entailing. The other thing I can do is I can look up this procedure on YouTube based off of the terminology. And sometimes you'll find some really cool procedures here. So a modified radical mastectomy I can see that there's some images that are going to be easier to watch than others. I personally love the surgery videos, but if those make you a little query, maybe take a look at one of the ones that gives you an animated video. We do have some videos in this class and other procedural classes, some which are mandatory and some which are optional. This is going to show us all the detail. And of course, when there's sound, we'll be able to hear the information of what they're entailing in this procedure. So if you're having issues trying to understand what they're talking about, where they're going, or how they're doing it, these types of videos can really help. Now, I digress. Let's finish up this code and get moving on to our final code for the evening so we can all go home. So when I come back here and I look at this last detail that I had highlighted about the nerves and the nerve bundles, I'm going to understand from the diagrams that I look at that this is just talking about the nerves that are bundled around the breast tissue and that they spared them. So they didn't include that. And that's important to know for providers' purposes, but it wouldn't affect my coding. The auxiliary lymph nodes will be examined for metastasis. That means that they're sending it off to pathology, which means that if I'm not sure if they had removed them, that's what they're telling me. So that's kind of a confirmation. At that point, they said there was no palpable adenopathy in the level 3, which is just another location on the body. The breast and axilla were marked for orientation, weighed, and sent to pathology. So they're putting them in those little plastic bottle jars so they can send them to the pathologist. At this point, one of my favorite terms, irrigation was performed. That means that they started cleaning out the wound and putting in saline and antiseptic into the wound so they could close it. Homeostasis was achieved. So as soon as I start seeing these two terms, which I see a lot in my procedure, I know we're pretty much finishing up. They tell us what type of closure they did, and most of the time this is included in the procedure, especially with major procedures. So I won't even need to code for that. And there's no evidence of bleeding at the end of the case. And I say, oh, that's nice. That means that the case is done. There's no additional things to be coded. So I can now come back and summarize, what did I highlight? I highlighted that we looked at the right breast, which is correct. The details, which may not be necessary for all of my coding, but what is necessary is to say that the details were that the breast was removed, it was separated from the pectoralis major muscle. It did include the fascia, and it also included the lymph nodes. And so I can come back to my coding options and I can say, if I don't know already that I'm looking at a modified radical procedure, I can look at all of my mastectomies and look at the detail until I find the description, which that guideline is going to tell me for what this applies. And in this case, the code we looked at initially is correct. 19307 includes a mastectomy for modified radical, including auxiliary lymph nodes with or without the pectoralis muscle, minor muscle, which is fine because we didn't get it, but excluding the pectoralis major muscle, which is also fine because we did not get it. And so 19307 is accurate, and we want to add a modifier for the side, which is the RT from your HCPCS for right. Now, after that, your left one is going to seem like a breeze. We have a left prophylactic mastectomy. And so the first thing I would say is, would a modifier 50, because we did bilateral procedures, apply? And the answer would be no, because the left mastectomy was not the same type of mastectomy. It was not modified radical. It was done prophylactically, and we need to come in and determine if it included any surrounding tissue, but it most likely did not. So I'm going to come back to the part where I stopped earlier and say, okay, here's my left side. Now, if I want to, I can come through here and I can look at all of these details, not there, all of these details here, and look at the description again to see what does each of the codes entail. So a partial mastectomy is only a portion of the breast tissue, such as a lumpectomy. A complete or total removal is of the entire breast with or without the skin or nipples. The option also does not include pectoral muscles or any of the internal mammary lymph nodes. Okay. And then our radical ones, which does include nipple treatment, or the nipple, and the pectoral muscles and or auxiliary lymph nodes or modified versions of that. So that's important to say, okay, is this a lumpectomy, meaning did they leave a portion of the breast behind? Is this a complete removal of the breast? And if so, did they take any surrounding tissue, including the lymph nodes, the muscles, or the nipple? So those are my three things that I'm looking to determine the difference between 301, 302, 303, 05, 06, and the one we just discovered, which was 07. So that's it. Those are the codes I need to determine. Coming back here, again, I'm going to see the same kind of information. They're incorporating a nipple areolar complex, meaning, as we said earlier, they want to save the nipple. It's carried down through the skin into the subcutaneous tissue. That's important to say, hey, it's not including the muscle. I want to confirm that, but so far, if it's carried through the subcutaneous tissue, that means the muscle is not involved. Flaps of the skin are raised. The location of that is being described. The breast was then removed. So good. I do, in fact, confirm that a mastectomy was done of the left side from the pectoralis major muscle, incorporating the fascia and reflected laterally and truncated. Now, truncated is a word I've had many students ask about. So let's look it up together. We're going to look for the definition for truncated, which simply means shortened in duration or without its top or end section. And we can go further and look at additional details. So to shorten by or by cutting off, to replace by a plane, which is not the case here. And we can even take it one more step and say surgical. Definition. And this is just saying to cut short. So that helps us when we're looking through this, if we see these terms that are maybe unfamiliar to us. So they're just simply saying that it was cut along the side and then cut short. So it was cut off. It's marked for orientation, weighed, and sent to pathology. So at this point, same as earlier, this is where they start to do the closure. They're saying we're done with this procedure. The tissue was separated or truncated, and we're going to send it off to the lab. Their hemostasis was achieved, meaning the patient is doing well, they're not bleeding out, and we're ready to move on to the next procedure. So we've now looked at everything for the left side. And in all terms, this is just a complete mastectomy. They removed all of the breast tissue. It was not a lumpectomy, but they did not include anything other than the actual breast. And so we're going to come back here to our codes, and we're going to look for our complete options, which we have simple complete, as well as radical, which we know this was not. So 19303 does meet the definition for a mastectomy that is simply just listed as a mastectomy without the additional information. We also want to look at any additional notes here under both codes now to see if there's anything else we need to add. So far I have 19307 with modifier RT. I've determined that modifier 50 does not apply. I can look at these, and I want to also determine modifier 51 because there are multiple procedures. There's more than one. And in this case, if I look at my CPT codebook, or if I look at the symbols with these codes, I will see that there are no symbols, which means that this is not modifier 51 exempt. So I have to add a modifier 51 to the secondary procedure, which is the less intensive procedure. And then this case would be the 19303 for the simple mastectomy of the left breast. So I'm going to list my codes as 19307-RT, comma, space, 19303-LT-51 for multiple procedures. Now it seems like I'm almost done, but I want to look through everything else that we have here. We have intraoperative placement of clips is not separately reported. That's where they put a little metal clip in the breast tissue that's left behind to identify where a lump was. This is not the case, and it wouldn't be reported anyways because we didn't do that. For immediate or delayed insertion of an implant, there are codes here, and we may want to look at that. However, one thing that I highlighted here, and I pulled it up when I did my 3M, is that reconstructive surgery is going to be planned for a later time. But they did not indicate the type of reconstructive surgery. Most likely they're talking about implants, but they may not be. And so for that purposes, I'm going to look at these codes, but I'm probably not going to select one. This is something that would be an important detail to talk with your providers because there could be missed opportunities for additional coding that should be selected. The guideline that I already saw talking about the male mastectomy and the code to use. References to code 19304 being deleted is beneficial for if you are familiar with that code, but if you haven't used it in the past because you're a new coder, that's really not something that you need to be aware of or can use at this time. Breast tissue and breast reduction code options, and breast tissue removed for breast size reduction code options. So everything else we see here does not apply to our procedure. And I will look at the same thing here for my first procedure. So the other thing I want to look at, and remember I said I might look further, is under the reference of immediate or delayed implants to see 19340 and 19342. These same statements are listed on page 123 when you're coding from the CPT code book. So I'm going to go to that section now. 19340 and 19342 in the CPT Codebook are found on page 125. There are several guidelines that talk about breast reconstruction procedures. And so I want to look through those in-section guidelines to see if anything is pertaining to the two codes I was referenced to. I can read through this whole thing, but the real thing that I want to look at is it required to say what type of planned reconstructive surgery? Because they did mention that it's planned for later. Now the code for 19340, before I get ahead of myself, is insertion of a breast implant on the same day. That would not apply. Or insertion of replacement of breast implant on separate day for mastectomy. That would apply if in fact the procedure is to be a breast implant. When they talk about reconstruction, they didn't mention it in the note. And you know my golden rule, not just mine, but the golden rule of coding is that if it's not documented, it didn't happen. I can also see there's symbols here next to these codes for the revised code. So this means that this description has changed since previous years. Okay, so I'm almost ready to code for this one. Oh, I don't know what happened. So that threw me off. Okay, so we were looking at our 99340 and 99342. 99340 would not apply. 99342 does indicate that the breast implant is planned on a separate day of the procedure that we have today. There is instructions not to code it along with 19328, which is not one of the codes we have for today. There is instructions that if there is an expander and replacement for the breast implant, how to list that, or for the supply of the implant, how to list that. From everything that we saw in our note today, these codes will not apply. Again, with them simply saying she's planning on having reconstructive surgery at a later time, but not what that plan is, we cannot say that with certainty that that is going to be an implant for the breast. So let's take a look now and compare what we had. As I mentioned, we would not have the 19342. So I'm going to delete those from my 3M. And I can see here codes 19307 with the RT modifier and 19303 with the LT modifier do in fact both list when I search for mastectomies. And as one last thing to show you how we get that, I'm going to enter mastectomy in 3M, identify the type of mastectomy, which is modified radical unilateral for one side of the right breast without indication of implant. The question for with identification of mapping and incidental nodes, which would be for if there's mapping done or radiological services. This was not indicated, so it was not done. Are there additional breast procedures? I may look through here to see if the additional mastectomy is listed. It is not, and so I'm going to say no. And that's how I came to 19307. I can see my code path here, and I can copy it if I need to. I can hit continue, add procedure, code for mastectomy. This is of the left breast, which is not going to fall under the definition of an excisional regional lymph nodes, modified radical, extended. None of these details are listed. However, a skin and nipple sparing total might be accurate. I want to go under other or unspecified. This is not a quadrant resection of the breast. So we're not taking just a part of the breast. We took the entire breast. This is of the left breast. Again, there's no clear definition that the delayed reconstructive surgery is an implant. There are no additional breast services. And so here I can see 19303 with the LT modifier. The only thing 3M does not identify for me is the need for the modifier 51. And so that's up to you as the coder in your CPT codebook to identify. Well, that's all for this round. Sorry for the slight confusion towards the end. My computer did a glitch and I had to pause and come back in, but we've coded our complete discussion. If you have questions or issues, feel free to let me know. Otherwise, have a wonderful day.